welcome to this episode of the Security Nurse Podcast. I have joining with me today Eric Sean Clay. Eric, how are you today?
Very well, thank you. How about yourself?
I'm doing well. It's a little chilly here in Michigan. I'm sure it's nice and warm there in Texas. Well, will you give our viewers a little bit of background about yourself? And then my favorite question that I always start with every guest is what is kind of that aha moment that led you to what you're doing today?
Okay, so the vice president of security for Memorial Hermann, which is a large healthcare system in Texas. I'm the immediate past president of the International Association for Healthcare Security and Safety. Been doing law enforcement and security for about 3 decades now. Really enjoy it. Enjoy helping people. Just a different way of helping than maybe I've done in the past, but still, I think the role of a security professional in healthcare is critically important to the community. And that we help ensure that our caregivers are able to provide that quality care relatively free of violence, and that the community has access to that care. So to me, that's probably one of those, the aha moments of not really thinking about things that way. Seeing my time in law enforcement, the military, and some of those other roles is, that's how I can contribute at the highest level that I'm going to be able to contribute at. But I think looking at what we do in healthcare security is just so important. Is that people aren't able to come to a hospital and get treatment during their most vulnerable moments if they don't feel safe, if the caregivers don't feel safe. So I think what we do is very important.
I would absolutely agree with that. And I think, you do have a pretty extensive background both in and out of healthcare. And so that kind of leads into my first question for you. How do you think healthcare security really differs from like other public venues?
I think probably the biggest difference for me would be just EMTALA and the fact that we don't necessarily have the ability to refuse service to people. So they can come in, they can be incredibly violent, assaultive, verbally abusive, and we're still going to have to deal with that person and stabilize them and make sure that they're okay before we can ask them to leave. Most other venues, they can say private property, you need to leave right now. We're going to call law enforcement. We are not able to do so. So I think it requires us to really work with people who other organizations, verticals would not deal with.
Yeah, no, that's so true, and that you don't have that ability to say sorry, you can't be seen here. EMTALA absolutely is a very different when it comes to providing care and services for people. How have you seen kind of the threat landscape change, with that in mind and with EMTALA in mind, and that we can't turn anybody away? How have you seen the threat landscape change within healthcare and the violence change over the years?
I don't think you would speak to anyone who works in healthcare that would tell you that things have gotten less violent. Since COVID, I think things have only gotten more violent, which is sad and something that we're forced to deal with on a regular basis. And again, we see healthcare providers, caregivers leaving the organizations that they work for because it has gotten so bad. So as far as the change, again, I think it's gotten worse. I think people's expectations have gotten higher. I think their tolerance, their patience has diminished. I think that, although caregivers are in their roles for the right reasons, they want to help people. I think that, again, that we're going to continue to see more and more people leave the field if we don't do a better job of protecting these caregivers. I really think that, in my opinion, that we really need to prioritize the safety and security of our caregivers over, a lot of organizations will say, the patient's always right, regardless. And caregivers will tell me that they feel that they're blamed if there is an escalation of a patient. I don't think that, perhaps there was a time when that was true, but I think that the dynamic has shifted and we really need to start focusing on keeping our caregivers safe. If we fail to do so, I think you're going to see a long lasting impact on quality of healthcare. I think patient outcomes would go down. I think the cost of healthcare is going to continue to rise. And I think it's going to just have this long lasting problem if we don't do something to better protect our caregivers.
Yeah, I think, I remember, I want to say maybe like 2009, it was kind of that shift from like they're not, we're not calling them patients anymore. We're calling them customers, right? And for us in a clinical setting, it was kind of like customers, like, what do you, they don't choose me to come here. It's not necessarily a choice. How are they my like to us, like customer, implied they had a choice. And a lot of times people don't have a choice. They have to come to the hospital or whatever is closest to them, especially in an emergent situation. And so with that kind of mindset, I think maybe it was good intentions of the customers always, right? Kind of like what you're saying, but over time, and with EMTALA, there's no changing EMTALA. EMTALA has its place. It's important that it's there, but over time, change the boundaries. So being able to set up boundaries and set that level of expectation of how you behave when you come to a healthcare facility just kind of slowly eroded and gone to the wayside. Just culturally, I think, as a society, a lot of that behavior has kind of gone to the wayside. And one of the things that we're going to talk about today is weapon detection systems. And I kind of see that as a way to reestablish a boundary, right? Put those weapon detection systems in to kind of help set a boundary. Sends a very visual picture of, we're not tolerating weapons inside of our healthcare facilities. So moving forward with that, what's kind of the top priorities with evaluating what kind of weapons detection system you may want in your healthcare facility?
But I think there's a lot of different, systems, as out there that make a lot of different claims about the effectiveness of their devices. I think, for me, and looking at weapons detection systems, looking at what we're seeing, I mean, we know we're not seeing everything that's going on, but what are we seeing mostly? Are we seeing, what are officers removing from visitors and patients that are coming in? Are we seeing a lot of guns, or are we seeing a lot of knives? And typically you're going to see a lot more knives than you're going to see guns that are coming into a facility. So really looking at how well those devices work as far as what threats that you're looking for, and they can be calibrated to go up and down, of course, so you can really kind of to dial those things in. But I think, really looking at what's the threat that you're facing and what are you trying to prevent from entering your facility. And then just do your due diligence on the different systems and figure out which one best meets those needs. And one of the things when I was looking at weapons detection was portability of the system. How easily can it be moved? Because I started to hear that there were different groups like the Joint Commission or some of the other accrediting bodies would come in, DNV, and look at your weapons detection system and how portable was it. And if that someone was going to, if you had to evacuate the building, how much time would it take to remove that system to make sure that you had an easy egress? And I was hearing fire marshals were looking at that as well and citing organizations. So really making sure that something was portable enough that if we did have to evacuate a facility, could the officer do it very quickly? And was it written in their post orders that if should we evacuate the building, the first job that I have is to remove this weapons detection system out of the way? So making sure that it was portable enough to do that was a huge consideration as well. Price, of course, factors in. There's a wide range in price between these devices, and so really, I think just what meets your needs. Is it effective in what you're trying to prevent, and is it something that your organization can afford? Are probably the things that I think I would look at right off the bat.
That's the first that I have actually heard of, the portability and the egress. I was going to follow up with that question, but you answered it for me, so I appreciate that. So that's one of the things that they're actually looking at, is if it can be moved out of the way so it doesn't impede egress.
That's my understanding. From when I talk about things, a lot of times I'm not necessarily talking about where I work at today, because I do talk to healthcare providers from around the country. I talk to caregivers from around the country, and so a lot of the things that I speak about are things I've heard from other organizations. So I haven't had any personal experience with someone coming in and looking at our weapons detection system and asking that, but I try to stay ahead of things, and so I definitely incorporated that into the decision making that we had. And then again, the post orders, making sure the officers understood that that's job one, and if they're questioned by a surveyor and said, what are you going to do if we evacuate the building? First thing we're going to do is we're going to make sure we've moved this weapons detection system out of the way so that people can get out of the building in an orderly fashion and we're not creating a choke point.
No, that makes a lot of sense. And I think you bring up like another good point on staying ahead of it, right? So not just understanding like what your organization might need right this day, but what are they going to need in 3 years, 5 years? Like how might that threat landscape change? How might the whatever we implement today need to change with it, right? Sustainability and being able to grow with the organization, I think is absolutely a good good thing to have.
I think
Yeah.
that, a lot of Security dollars are difficult to come across quite often. I often say that, we're a security department that supports a hospital, not a hospital that supports a security department. So our budgets, we really have to make sure that the solutions we come up with are good solutions that will be effective long-term solutions. They're not, we're not just knee-jerk reaction and go, we got to do something right now, because that may not be effective down the road. So making sure that, the solutions we come up with have a long-term benefit to the organization, I think not only better serves the organization, but it gives us the credibility. So when we come back and we ask for something down the road, there's nothing to refer back to and say, well, you came up with this idea a year ago and it's not been effective. And so why should I think today's going to be any better? So making good data driven decisions, I think, is critically important for healthcare security professionals.
Absolutely. And are there any other places where you get that data from? You mentioned IHSS, which has a lot of data, but is there anywhere else where you pull that data from as well that goes into your decision making?
I think, the other big organization is ASIS. Of course, they put out a lot of great work. I've been a member for 20 plus years. Definitely value the opinion of the people that are at ASIS. A lot of those are the same people that are IHSS. But I think for me, it's really a lot of it comes from my role as the immediate past president of IHSS, and being very visible on social media. I talk to a lot of different people, but I think reading, I've Google search is set up where it's looking for anything that occurs in a hospital from a security standpoint. So it could be, firearms in a hospital, um, violence in a hospital, anything that has a nexus with hospital security. I'm looking for that information and reading all those news stories so I can kind of see, am I seeing something occurring over and over again? To me, there's a trend developing there, and there's a solution that needs to be thought of before it gets to us. So just really staying informed and taking your job, seriously, to where you consider yourself to be someone who's ahead of the curve, and not just responsive. And so you're like, yeah, we got a problem. We're going to need to come up how we're going to fix it. Because sometimes too, you'll have a leader at your organization will come to you and go, hey, I'm seeing this in the news. What do you think about this? Or it's nice to know and say, yeah, I've read a lot about this myself. If I had the opportunity, here's the solution I would come up with, and have a good solution queued up at that point, so that again builds credibility for you and your department. Lets them see that you are someone who is thinking, and that you're not just someone who responds to situations as they develop. You're forecasting what potential issues you may have and how would you solve those issues, so that if they do come to you and go, this is a problem, we got to solve it today, what are we going to do? You don't have to go, well, let me get back to you on that. You can say, well, here's exactly what I would do in that situation, and here's the solution. Here's what it cost, and here's how long maybe it would take to get it. Just having that information ahead of time, I think, is super beneficial.
I agree. So planning ahead, and when the C-suite comes to you and says they're finally ready to spend those dollars, you kind of have that plan in place, and having that operational readiness, right, to implement what you need to implement. Do you have weapons detections at just your ER, or do you also have them kind of at your main entrance as well?
Typically, in the ED is where we would put weapons detection systems, just because it's a 24-hour operation. So if we have after hours, entries, they're going to come through the ED. We know that the vast majority of violence, based upon square footage, EDs having very small footprints, but having more violence than larger portions of the hospital. That's a good place to have your weapons detection system. If sometimes when we see shootings in the community and they bring the patient there, there's always the concern, sometimes, well, not always a concern, but sometimes a concern by caregivers that someone's going to show up here and they're going to try to finish this person off. um, we try to put them where I think you can have the most benefit from them, and EDs are typically going to be your biggest benefit. And then when you consider the cost of staffing for these devices to cover, hospitals are typically very porous organizations. And so having weapons detection at every entrance can be quite costly. So I think, really prioritizing, looking at where are we seeing the most violence, where are we seeing the most weapons entering our system? Is this a 24-hour entrance? So we're going to not, shut it down after 8 hours, things like that. I think help drive that proposition when you say, this is where we think it needs to go.
Yeah, I think statistically it makes sense. I mean, look at all the data, and it really does show a lot of the violence is happening in the emergency department. But when you start to kind of look at some of the recent events, and this is maybe where like kind of that knee jerk reaction comes in. We did just have the shooting at UMPC in Pennsylvania months ago. And then you and I were just talking off camera. Unfortunately, they had another incident, possibly sounds like outside of the hospital. But then even looking at over the course of the few years, there's a couple of shootings events in like a labor delivery unit in Dallas where two nurses lost their life down there as well in that situation. And so I don't want to like put you on the spot here, but do you see maybe a trend where we have to start looking at putting weapons detections into kind of a more of a main entrance?
I mean, I think the use of weapons detection systems are only going to grow over the next several years. I think organizations, as they look for ways to better protect and make their employees feel better protected, weapons detection system is a huge anxiety reliever for staff. Again, the cost is really around the staffing of them. So I think as AI becomes more, machine learning becomes more experienced in how to do some of the things that it's doing, and it's making, these jumping hurdles every day. I mean, it's incredible, the advancement. I think there'll be opportunities to look at how can we use these with less staffing. But I think that typically an organization really needs to look at where their vulnerabilities at, and we know that labor delivery departments are a place where there can often be violence for a number of different reasons. It makes sense for that organization to add weapons detection systems there. But again, I think that the hospitals, they really focus on how can we provide the highest quality of care, how can we, and the equipment that they typically buy are things that go towards care delivery rather than the weapons detection systems and things like that. And I know some would argue that's not the right way to look at it, but I think that if you do your security vulnerability assessments, you do your threat assessments, and you develop a need for those systems, quite often they can be nice to have, but not necessary, because you're not seeing that sort of violence occurring. But once you do, then I think definitely you want to look at it and say, okay, we are seeing this, and now we need to come up with a solution to prevent this, because you could put a weapons detection system at every entrance of the organization to try to keep weapons out, and you would be successful in keeping a lot of those weapons out. However, I don't think that they're going to do that, just because there's not that need at this point for it. And I don't want to say wait until someone gets shot and then we want to do that. I think if you're seeing a lot of guns coming in, you're seeing a lot of knives coming in, you're having a lot of violence. And what I would advise too is that, there's companies that will look and they will give you a snapshot of crime rates around your hospital. I think you look at information like that and you say, okay, we're seeing there's a lot of gun violence in the 1 to 3 to 5 mile radius around our facility. We know that we're a microcosm of the community that we serve. We can anticipate that we're going to see more gun violence inside our facility based upon the fact that it's happening all around us. We're not an oasis or an island that's immune from all these different things. Look at that information and say, I think, maybe weapons detection system makes sense at this point. And it may have to be a phased approach where, again, with the costs that are associated, quite often healthcare organizations have very, very slim margins. Some people think healthcare is just this makes a lot of money. You may have 1% margin. And when you look at the community care, the money that is never billed and is given back to the community, I mean, the margins are very slim. So I ask people to remember that. Just say a lot of the money that comes in is going to go back to ensuring we can provide care for the community. And that really have to make those investments in doing those things. But when you see a problem, I think, you certainly want to address it.
Yeah, and so just to kind of recap, and you're talking about like those crime heat maps, right? Like around your facility, taking that into consideration and kind of this phased approach. So maybe it's you install them in your emergency department, and then you start keeping track of the statistics of how many weapons are you confiscating through your emergency department, and then you look at, okay, now how many people are coming through our front entrance, right? And how can we maybe translate some of those numbers to, the probability of the amount of people that are just bringing them through our front entrance that we're not screening, and bringing in all of that data and planning for it, being that operational readiness, being ready. So it's not so much a matter of like if, but when. And having that on kind of the back burner of, okay, if we're going to install it in our ER, let's keep it in the back of our minds here that we may have to expand this based on the data that we get, and be prepared for that. And so you talk about, having to staff that, and AI starting to get a little bit more sensitive and a little bit more tech savvy, and being able to be a part of that weapons detection. Can you speak a little bit to how that works? Do you guys use some of the AI in your weapons detection systems there?
I mean, I think every web search system has got the AI and the machine learning built into it. It is looking for specific shapes. It's getting better as it goes on. It's learning what it's doing and improving. One of the things that I find interesting. And, I always try not to bring up specific companies, but in talking with a concealed weapons detection manufacturer, Athena, they have a that allows them to um, so you could have an entrance. Say you have a side entrance that people are going to come in. They can lock that entrance, and then the person comes in. It has they have a badge scanner or an ID scanner, so they can scan that person's ID. It can look against the trespass list. It can look and see, should this person be here or not. And then if it determines the person, there's no reason for them not to be there. It gives them a pass to come in that day. They walk through the weapons detection system, and if they clear the weapons detection system, it opens the doors. If they hit the weapons detection system and it doesn't clear, then it notifies security and says there's a person trying to get in and they're not cleared through weapons detection. So you wouldn't necessarily have to man that in order to use it. And it can tell if more than one person comes in. It can tell if people are going out, the entrance. So it does a lot of really interesting things that I think, again, you're seeing this evolution where they're making it smarter and able to do more, which the systems, are not inexpensive, but really the real money's tied up in staffing those things 24 hours a day. Because quite often you're going to have two officers working the weapons detection system to ensure that if one officer's dealing with a person who has set off the system, you don't have somebody who can bypass it by walking in behind them. So that can get costly in the long run.
Yeah, that sounds like a really interesting system and being able to check that out. I know so many of them, like you said, are kind of staying on that cutting edge of how can we continue to use AI in our systems, but then also understand like the workflow, right? The workflow of how a hospital works, which leads me to my next question, which might be a little controversial. It's the do we only put visitors? Do we only have visitors go through our weapons detection, or do we scan employees too? And do we have employees go through there? What are your thoughts on that one?
I mean, I think that it's two sides of a coin. There's going to be some people, and I do know, at least one hospital system in Florida that has their employees go through as well. I know that that hasn't been well received by some of the employees. And I actually, now that I think about it, I know of one other that uses a different system, not the same one they use for visitors and patients to come through, but they have a different system. And if someone walks by it, I guess they have a camera on it. And if they set off the weapons detection, they dispatch an officer to contact that employee. So for me at this point, I haven't seen any reason to want to see employees go through there. I think, there's always that potential for an insider threat type situation, but I try to be data driven and I haven't seen a situation where I've said, you know what, employees should have to go through weapons detection. That could change tomorrow. There could be an event that occurs. We've seen at several hospitals where employees have gotten into arguments and there's been gunplay and one employee shot another employee. I think at that point, then you make that determination. Is this something that, warrants us making every employee go through? I've just never, at any organization I've worked at, experienced something like that where I said, yeah, we need to really focus on vetting our employees as far as weapons detection goes.
Yeah, I haven't seen too many instances either in the news or elsewhere of where there's too much employee violence, and a lot of times, and this is maybe another question, a lot of it takes place out in the parking lot as well. Are there any weapons detection systems that you know of that kind of help monitor parking lots as well, or is it really just standalone at this point?
I mean, I think the only thing that you could really do would be to have AI enabled cameras that are looking for weapons in the parking lots to see if someone is manipulating a weapon, which I think is a fantastic technology from the standpoint of that. Quite often, if someone is going to bring a gun in, they may have it in their hand in the parking lot, tucking it into their waistband or having a long rifle, anything like that. If it could give us, 90 seconds of heads up that there's a person with a weapon headed towards the door, then we could put security resources in between them and the building so they don't even make it into the building. I think it was in Cincinnati where we saw a person come into a medical facility and there was weapons detection, traditional metal detection there. As soon as they saw the metal detection, they just started their attack right then because they knew I'm not getting through the weapons detection with this firearm. So I'm just going to start shooting as soon as I come in. So I think knowing you've got someone who's motivated and wants to do that sort of damage, being able to see them before they make it to your facility is a tremendous advantage for you and everybody that you're there to keep safe.
I would agree with that. And I knew about the cameras. I just wasn't sure how much they were really being implemented in the parking lots. Is that something that you would have to install new cameras for? Like they'd have to be enabled with that? Do you know? or is
It's
it
just it's a software that
the
you put
software
on.
that can be
It's a
integrated?
license for each camera, typically, that puts the analytics in the camera for you, so you don't have to replace the cameras. And another thing that you've got to think about is the fact that we can prevent employees from bringing firearms in the facility, but you can't really prevent employees having firearms in their vehicles. They have the right to be able to travel from their home to the facility with a firearm, so we can't say no, you have to leave your firearm at home. So there's probably a lot of firearms in your parking lot facilities that you hope never becomes an issue. You see a lot of vehicle burglaries because people know that you can't bring your gun inside of the facility. So criminals will quite often target hospitals, looking for vehicles that maybe have a decal on the back that says Glock or hunter or something like that, and they think there's potential for a firearm in there. I'm going to go ahead and break into this car and look and see what I find. So just would caution people not to advertise if they're going to have a firearm in the car, because people do notice that and take those opportunities to secure firearms.
Yeah, the bumper stickers and all of that, that kind of advertiser lifestyle is very much an attractant to any kind of would-be criminal as well. Do you have any kind of data? You talked about the hospital in Cincinnati where the incident took place, and the criminal, the person that was had the weapons, decided to go ahead and open fire before they even made it through the weapons detection because they saw it. Do you have any other data as far as the deterrence and how well weapons detection systems are working in systems?
I mean, I really can't think of any hard data. I know a friend of mine, Michael Gips, had written a paper on weapons detection not too long ago. I can't really say. I can give you the personal experience that I've had is that there's not been weapons getting through once weapons detection system has been implemented. I can tell you that caregivers, the anxiety levels have gone down, and you hear that when talking to them about how safer they feel knowing that guns are not getting in the facility. You're stopping a lot of knives as well. You try to really set the system so that it is not overly cumbersome for people coming through the facility. You're really looking for weapons. You're not looking for keys. You're not looking for phones, things like that. So you don't want to set it to where it's like a traditional metal detector. Any amount of metal is going to set it off, because then you've got a bottleneck of people trying to get into your facility. So I think really one of the things that we did was we took a lot of different weapons and we walked through the system with a lot of different weapons, and we looked, what's the smallest gun that we think we're going to experience. And, we thought Derringers would be a good one. And then we found some revolvers that had a tremendous amount of polymer in them that weren't setting off the system. So we're like, we need to recalibrate so we can make sure that we prevent this particular weapon from coming in. So I think really doing your due diligence and getting, it's not probably a lot of your security officers or your security leaders are, former law enforcement or people who have firearms, bringing in some different guns and walking through the system and trying to figure out what that needs to look like. So you're not hitting keys, you're not hitting phones, you're hitting specifically the weapons that you want to keep out of your facility. And a lot of people will say, well, they can't stop every knife that comes through, and that's typically true, is because the metal content is not going to be that high. But what these systems are really looking for are, mass casualty weapons. How many can I shoot a bunch of people, from a great distance and cause, as much death and destruction as I can? Whereas the knife, not going to say it's not a deadly instrument and things like that, but what they're really focused on are guns and stopping guns from coming into the facility. So just really, again, finding that proper setting where you think that this is what I'm seeing the most of. This is what I want to focus on keeping out, and setting your system up to do that.
Yeah, I agree. And kind of going back to what you had said a little bit earlier before too. And I just wanted to kind of chime in on this about, sometimes we think safety and security is separate from patient care. And I would just argue Maslow's hierarchy of needs here, and how the very bottom of the pyramid is safety, security, your health, housing, food. I mean, it's the very bottom of the triangle. Without that stability, that psychological safety, reaching the potential of actually having good care outcomes can be harmed if you're not providing safety for your patients and for your staff. And so when I started this podcast and talked to people such as yourself, Eric, and talking about safety and security in healthcare, to me as a nurse, this really goes into patient care and how we can achieve good outcomes for everyone that's in those healthcare facilities.
I would agree, and it's what I tell my team is that we are a part of the health. We are part of the caregiver team. Um, that I do not see our role as any less important than the highest paid physician or the most skilled nurse. That um, people are not going to come to where they don't feel safe. Caregivers aren't going to want to work or provide quality care where they don't feel safe. They're going to be focused on, worrying about whether this patient's going to hurt them. And if we provide a high level of care for our caregivers, it frees them up to do what they want to do, which is provide that quality care. And it lets our patients really focus on healing and get better. So I think that, we're all part of that care team, as you alluded to.
Yeah, absolutely. I mean, I've had patients express concern of, other patients coming into their rooms looking for drugs and different things like that. And so, if patients don't feel safe in the facilities where they're getting care, they're not going to be able to get better. And going to the messaging that you're talking about with your team as well, and that they're part of the care team, what's some of the training that you also provide when you implement these weapons detections? Like what's some of the key things that you really want your staff to know about when they're running these detection systems?
Well, I think one of the biggest thing is around messaging is letting the employees know what the purpose of the system is and making sure. Some people, when we first start talking about weapons detection, some people will say things like, "Well, this is going to give the impression that we're not a safe environment if we have these weapons detection systems here," and that's really not the focus of what these are. They are about providing a safe and secure environment, and we are really responding to what's going on in the world today. It's not the nicest hospitals have violence in them. There's not, any hospital I can think of that would probably tell you that we don't have any violence here, none whatsoever. So I think, what we're doing is we're trying to be proactive and prevent things from happening. It's not necessarily in response, and it kind of contradicts what I said earlier about we're seeing these things coming in, but I mean we're seeing weapons introduced into our facility, but 99% of the time it's someone who just, a woman who carries a firearm in her purse and forgets about it, or it's a person who carries a firearm everywhere they go and they think that there's no reason why I can't carry it into the hospital. I'm unaware of the laws that say I can't do that. Or people who just have pocket knives. It's not people who are coming in and wanting to do harm to people. It's just part of their everyday carry is what they have. So I think what we just make sure they understand is this isn't, we don't have this threat against the organization and we're not responding to someone saying they're going to do harm. It is just a proactive approach to trying to prevent things from happening and keep you as safe as we possibly can. And I think that quite often efforts like that, the ROI in security is often difficult to prove because you can't prove what you're preventing from happening. But I think things like weapons detection system are great from the standpoint of, again, that they do lessen caregiver anxiety. So I think that is going to show up eventually in HCAP scores where people are getting better because caregivers are focused on providing care and not, half in, half out. I think that some of the other benefits can be as you recruit and retain your employees is that you're making significant investments in their safety and security. If healthcare system A is investing money in weapons detection systems and healthcare system B is not, I think that nurses from healthcare system B are going to look at that and go, I would feel safer over there because they are actively working to prevent these things from happening that I'm seeing in the news. So maybe I want to go work over there. So I think you look at it from the standpoint of that and say, how are we showing a return on investment? These are the ways that we're doing it.
Yeah, I would agree. I know after the UNPC, I was seeing just kind of social media and a lot of the nursing just kind of say why, where were the weapons detection systems? They should be at every door. And a lot of them were even saying an employee should be going through them too. So, I mean, I think there's definitely a culture shift even within among caregivers that they are wanting systems in place. They are wanting to be safer at work and being kept safer at work, and that's definitely one of the arguments is those security systems that allow them to know that that safety net is there.
I think there's, another thing that you're starting to see is X-ray machines, high-speed X-ray machines that are being manufactured by weapons detection companies that go side by side as the person walks through the weapons detection system. They're able to put their bag on the conveyor belt, and it shoots the bag through at a very quick rate. As quickly as you're walking through, your bag will be on the other side, and it is using AI to look for shapes of weapons, whether it be knives or firearms or other things that are suspicious. And through machine learning, it's learning what different weapon systems might look like, and it will tell the officer. And leaning back on Athena again, they have a similar system to that, and they have smart glasses now. So the officer doesn't have to be looking towards the system. It's going to show up in the lenses of the glasses that there's a problem with this particular bag. So, I mean, I think these companies are getting very, coming up with great ideas that, the stuff that you've probably seen in movies years ago and you thought that's crazy. And then today, these things are starting to become a reality.
Yeah.
So ingenuity is just is fascinating to me that they're constantly working to differentiate themselves and provide a better product that does a lot more things than it did even the day before yesterday.
Yeah. Yeah, I got my Apple Watch on, right? So we got I'm old
Dick
enough
Tracy
to yeah,
communicating.
Dick Tracy commute. I'm old enough to remember those days. And so it's definitely the future, and I'm waiting to, when we have our hologram, in the wall like Star Trek, and we can go over and
We got
request.
one.
You
We
got one?
system that we're testing, and again, it came from Athena, that is a holographic security officer. It's a life-size one. They work with you on the script, and has a camera built in, and it can speak over 100 different languages. It automatically recognizes what language you're speaking to it in, and it responds back in that language. And it can provide basic information on how to get from point A to point B. And then if it gets a question it can't answer, it notifies the dispatch center, and the dispatcher can communicate directly with that person, if we speak the same language. So
That's cool.
again, yeah, things that
That's
you would have
neat.
never thought companies are coming up with. I like trying out new things and figuring out, is this something that we can use? And I think that something like that is incredibly beneficial with the language skills that it has and the ability to, we don't have to put an officer sitting there that can speak maybe one, two, three languages and try to direct people how to get from point A to point B. We've got this holographic security officer that's there 24 hours a day and communicates in 100 different languages. And so it's a good use of technology at a good cost for us, I think.
Yeah, that's fantastic. I mean, when you argue, being culturally competent and giving culturally competent care, and again, that's one more thing to how your security can be part of that patient care experience and offering that whole person care, is understanding how the security department integrates into that from beginning to end. So that's really awesome. Well, Eric, I think we're going to wrap up our time. Thank you so much for being on today. Do you have any last thoughts to leave with the guests today?
I think you did such an amazing job that you left no stone unturned, and I can't think of anything. An interesting conversation. You made me put stuff out there that is probably things I would have said in any other venue. So I can't wait to see how this is received by people. Will they be like, absolutely, or will there be some people like, he's wrong on this one? So
I don't think anybody's going to
it
say
was not
that.
the safe environment that you would have thought. So, but I appreciate it.
Well, I try to create a safe environment for people to share things and get a little deeper than maybe what they ordinarily would. So thank you for validating that I accomplished what I try
You
to
did. This was not a
accomplish.
surface level conversation. I feel like we dug into things. So
I like it. Well, Eric, how can people get in touch with you if they want to reach out to you just to, be able to use you as a resource and connect with you?
I'd say just, LinkedIn's probably the best way to do it. I put a lot of stuff on LinkedIn, so I contact a lot of people on LinkedIn, and it's nice to be able to get on there and, because I'll lose people on my phone sometimes, but if, on LinkedIn, I can find virtually everybody. So if you're interested, yeah, I would say reach out to me on LinkedIn.
Perfect. I will make sure that your profile is in the show notes. So if anybody wants to get in touch with you, they can just click on it and it'll go right to your profile. All
Thanks
right.
again, Sarah. I look forward to seeing you in a